Terrific. Welcome, everybody. Thank you so much for joining us today. As I said at the beginning, a little housekeeping, we are recording this, so if you have to drop off before it's done, I'm more than happy to send you the link. We're also going to be posting it on our website and also our YouTube channel, so you can find it as well. Next slide, please. So for those of you who are not familiar with First Candle, we are a national nonprofit. We've been around for 40 years now, and we are committed to ending sleep-related infant deaths through education and especially through community partnership. We are especially concerned about the health equity and the racial disparity that exists in the rates of sleep-related infant deaths, and we are specifically addressing them. And at the same time, we also provide bereavement support to families in the community. I am a SIDS mom. I lost my son Connor in 1997, and Barb Himes, who's our Director of Education and Bereavement, lost her son on Christmas Eve morning over 40 years ago. So for us, this is definitely a work of passion as well. And we always say, if we can save one baby's life, we've done our job. So today we're going to be talking about our program, Let's Talk Community Chats, that we have been doing in partnership with Healthy Mothers, Healthy Babies Coalition of Georgia through a grant we received from HHS. And this is something that we've been working on for quite some time. We've already been doing Let's Talk Community Chats in New York as well as Philadelphia. But this one in particular, we wanted to highlight because we got a lot of good research and data out of it through our grant. And we're excited because this is really proving that what we're doing is working. And we are going to hear from some of our facilitators from Let's Talk Community Chats down in Atlanta, as well as Terry Miller, who is with the Department of Health down there. So I am very excited to turn it over to our new Program Director Destiny Stokes, who has been working on this program in Atlanta since its inception, and now she is part of our team and is going to be working on this throughout the country. So Destiny, feel free to take it away.
Perfect. Thanks, Allison. Thanks everyone for joining. I'm seeing everyone come in. So thank you for taking time out of your busy days, especially so close around Christmas and the holiday times. So we just appreciate you for joining today. Just to give a quick agenda of how we're gonna flow the presentation today. First, Allison did our welcome. I also want to invite you, if you can, put like your name and affiliation in the chat and say hello, just so we all know who's here. I will talk about our Let's Talk findings. Very excited to share that. We also have a panel discussion. Like Allison said, we've invited our community partners and Terry Miller, who's a part of our multi-sector team and also works with the Department of Public Health. And then we'll talk about next steps. We're really excited to expand next year, so I want to talk a little bit about that as well. There we go. Like my slides aren't advancing. There we go. So just a quick overview of the rates. So since 2020, the rates of sudden unexpected infant deaths have actually been increasing. In 2022, we reached a rate of 100.9 deaths per 100,000 live births. The map here at the top just shows what things look like across the country. And we see Georgia here. It ranks 10th highest in the rates. And so we are doing the work here in Georgia, so I wanted to highlight that. I also want to mention the disparities that we see. And we see that the highest rates are observed among non-Hispanic American Indian or Alaska Native infants, non-Hispanic Black infants, and non-Hispanic Native Hawaiian or other Pacific Islander infants. Our program specifically is targeting Black communities here in Atlanta, Georgia. Allison shared this work is funded by Office of Minority Health of Human Services. I'm so proud of myself for not even looking on the screen and remembering that. There's so many acronyms, but we're really grateful for their support for this work. And so this is a 3-year grant. And the first year we did an environmental scan. So we collected data from doulas, healthcare providers, Black birth givers, Black dads and support persons about their thoughts of infant safe sleep practices. We be happy to share that data with you. We're focusing on the event data today, but just wanted to share that that's what year 1 encompassed. And then in year 2, which we just completed in September, was these events that we did from April through August. And we're excited to add a 4th community partner in year 4 or in year 3 and expand the work that we're doing. I want to talk a little bit about our Let's Talk community chat strategy. And so our CEO, Allison, calls it the Costco method. And I love that analogy. So as you're shopping in Costco, you may stop by a table and get a little snack or a sample of something. And so why that's a great analogy for the work that we're doing is that we really want to be in places where families already are. We want to remove the burden for the families to have to come to us, and we want to be where they already are. And so here in Atlanta, we've learned that location is key, choosing places strategically. And so one of the places that we're at is a Black-owned bookstore, and you see this picture here with T and some participants. T's here, she'll talk a little bit later, but we're at a Black-owned bookstore. We've done community events, we've done YMCAs, we're in a storefront. So really aiming to be in places where families generally are, these high traffic areas. And so when we're there, we provide free education and support for families. And I want to highlight who's doing the facilitating. And so we partner with community partners that are already doing amazing work in the community. And we ask them to recruit some trusted community members. And we want dads, grandparents.
Oh, you are sorry.
Dads, grandparents, and doulas are doulas and lactation consultants. And that's very important because we want everyone to feel seen at these events. So a dad can talk to a dad, a grandparent can talk to a grandparent. Folks can also get advice from those doulas or lactation consultants that are there. And we offer in-depth supportive conversations, non-judgmental conversations, and really meeting families where they are. So we have our great trainer, Barb. She's our director of education. She trains these recruited, trusted community members on the AAP guidelines, the whys behind them, and really how to facilitate conversations with families, which is so important because each family can be at a different point of their parenting journey. Some parents could be, they have a 3-week-old baby, and that conversation could be completely different than someone that may be pregnant. And so our goal is to really meet families where they are, hear their concerns, and try to address them. And so we also implement a text campaign, which is great because it allows us to follow up with folks and to ask, even after you attended the event, what did you learn? Are you implementing any of these things? Is there any resources that you would need that we could share with you? I want to also mention that we want to be at these places the same time, the same place every month. That's really helped us establish ourselves in the community because people know on the 3rd Saturday, they're going to be there at 1 o'clock. And things could change along the way. What you experience at month 1 with an infant could be very different than what you experience at month 3 or 4. And being present at the same place and time allows us to show that we're there and to show up and that folks can also come back. So that's just our strategy, our method. And I'm going to go into what that's looked like over the past 6 months. To evaluate the program, we have 4 different tools that we use. The first is a facilitator debrief form, and that allows us to assess the topics discussed, suggestions for improvement. It also allows us to assess facilitator confidence. So right after they finish facilitating the event, we ask them, how confident did you feel to facilitate the event? Were there any topics discussed? That helps us shape our training. And then we also ask if they have any suggestions for improvement, if there's any additional materials they need, those sorts of things. And so we do that after each event. We also have a facilitator training feedback form that folks take right after the training with Barb. And so we ask, do you feel ready to facilitate these events? Are there any additional resources you need? So that allows us to get feedback right after. And then if there's any other resources they need, we can share those before folks start facilitating events. So those are the two facilitator evaluation tools. And then we have 2 participant evaluation tools as well. So the first one is a participant post survey. So right after folks engage in conversation with our facilitators, they do that participant survey, and it asks questions like, did you feel that the conversations were not didn't have bias or judgment? Did you feel comfortable talking to facilitators? Did you learn anything today? Did you intend to take anything you learned and implement it at home when it comes to safe sleep practices and breastfeeding? And so that's the data I'm going to get into in just a bit. And then we also have that texting program that I spoke about previously. And that, like I said, allows us to follow up with folks also. So into the data, first want to share a little bit about our results from the demographics. We had a total of 122 individuals that completed a participant post survey. And so, like I said, we did this event from these events April through August. We did it with 3 community partners, and I'm happy that each of them are here to share a little bit about their experiences today. But we have 3 community partners, and they did monthly events from April to August. So the data that you see today is from those events. And so I mentioned earlier that our target population is Black families, and we see that we hit the target population we were intending to, as 93% of our participants identified as Black or African American. We also took demographic data on age. 80% of respondents were aged 26 to 45. And then we took demographic information on the participant roles just to see who was showing up in these settings. And we see the 65% were mothers, birth givers, 23% were fathers, 10% was grandparents, and a few aunts and other caregivers. Results will be about event accessibility and engagement. So we asked them, how easy did you find it to access the event? And 96 participants said that they found it easy to locate and access. This is important because, like I said, our location is key, and we really want to be at places where families already are. We also asked them about their comfort with facilitators. Did you feel like you felt comfortable to talk to facilitators and approach them? And 98% said that they felt comfortable. We also asked if the event hours were convenient for them, and 97% found the hours convenient. So we did do the events on the weekends primarily, and they were like 11 to 4-ish on the weekends. And so we really want to make it to where families can show up and be there as well. We also asked them, who do you typically get your safe sleep information from? And so the highest was physicians, particularly OBs and pediatricians. Next, we have doulas, nurses, and midwives. Next, we have friends, online, and other family members. And so when we're in the community, I want to share that it's important that we educate everyone, right? Not just perinatal families, because we do see that folks are getting their information from friends, from online, from other folks. And so we want to make sure that we're educating everyone. And so, for example, when I've been to an event at the bookstore and there's people that walk by, we're not just looking for folks that have children with them. Anybody that walks by, we want to talk to, because this is a message that everyone should receive. We talked to church members that said, I need to take this information back to my church. Even if they have an older child, they may have a friend that has a young infant. So we want to make sure we're spreading this message to everyone. So next is the part I really love. We're getting to behavior change. And so this first part will be about those intentions. And so we see this data from the participant post survey, and I'm going to share a little bit of data in that texting program as well. And so we talked to folks, like I said, right after they have the conversations. There's still the event, but after they're having the conversations. And we have a question on the post survey that asks, where are you currently placing your baby to sleep? And if after having the conversation with the facilitators, did that change at all? And so we see that 30% of respondents were putting their baby to sleep in their bed before the event. And of those, 32% said that they would continue to have their baby sleep in the same place. But of those, 51% said that they would not continue to have their baby sleep in the same place based on the information from the event. We found this to be a very positive finding that after those engagement with facilitators and conversation, folks are saying, yes, my baby was placed in their bed before the event, but after, I'm not going to continue to do that. So it's a very positive finding for us. And we found that 16% were unsure. And we know that we can't change everyone's mind in one conversation, but to know that we are changing some and a high percentage, and to know that we are having these conversations and getting our messaging out, we're continuing to follow up with folks in that texting program is really promising. And so 43% of the respondents were already placing their baby to sleep in their crib or bassinet before the event, and 19% it didn't apply to them. So maybe they were a grandparent, an aunt, and didn't have a child to place their baby to sleep. And then lastly on this slide, around 96% found the information on safe sleep practices and breastfeeding helpful. So we also asked what they learned from the event. And so we have these top 5 answers here. And so what I want to highlight though, is it's a little bit of a fidelity check. And so we see that what people are learning are those key messages, those top messages that the facilitators are sharing with the participants. So the very first one is placing their baby on his or her back for every sleep. The safest place for a baby to sleep is separately, keeping those soft objects away. So it's really, helpful to see that those messages that we're trying to get out is what folks are reporting back that they're learning at these events. There we go. All right, then some quick stats. And so these are questions that we also ask on that participant survey. And so 92% of folks said that they were likely or very likely to attend future events. And this is really helpful for us because we are at the same place and time every month. And we do want families to come back and see us with any new concerns that they may have, or to come back and talk about the same thing again. We want them to come back and know that we're there to support them. And so 92% of folks said that they would be likely to attend again. 88% said that the information they received was free of bias and judgment. That's very important for us because we want to be sure that when families come to us, they feel like they can have conversations in a safe environment without bias, without judgment, and they can trust our facilitators. 93% said the products and recommendations were relevant to them, and 80% said that their specific questions or concerns were fully addressed. Share some participant quotes from the event. And so the first is the event coordinators were very kind and accommodating, and especially knowledgeable in safe sleep practices and newborn infant care. All of my concerns were addressed perfectly. The next is it's always best to get information from people who look like you and relate to you. And these quotes we found very impactful. Our main goal in this project is to make sure that, and I've said it many times today, but is to make sure that we're meeting families where they are. And we're very intentional that the facilitators look like the communities that we're serving. And so to hear that folks felt that the facilitators were kind and accommodating, and that they felt that it was great to have information from someone that looked like them and could relate to them. It proves that, what we set out to do, we're doing, and we're so happy that that's happening in these encounters. And we see this picture on the left is also at one of our bookstore location, and we see 2 dads having conversation. So I want to get into our texting survey results. And so 17 moms completed the 1-week survey, 11 moms completed the 1-month survey, 3 moms completed the 3-month survey, and 10 completed both the 1 week and 1 month. We see this natural loss to follow up that we anticipate, but something we are doing in this period of reevaluating and planning for next year is thinking about ways to engage folks more. And so we have a lot of that participant survey data that folks took at the event, but how can we engage them even more once they get home? Because what we really want to know is that when they're getting home, they're implementing the things that we talked about during those chats. And so we'll get into some of that data and some ways that we're thinking about engaging them more is sending out more health information relevant to their needs, and then also making sure that they can also respond back to us and engage in conversation and share any of their needs. And so 2 things I want to highlight that we found really promising from the texting survey responses. We have comparison at 1 week and 1 month. Like I said, we do 1 week, 1 month, and 3-month follow-up. And so from 1 week to 1 month, we see an increase in folks that share that they're now placing their baby on their back for every sleep. We also see an increase of folks that said that they now keep soft objects away from their infant sleep area. So we found this data to be very promising because it shows there is an increase happening with these safe sleep practices that we're speaking about at the events. about the use resources. And so I didn't mention this at the very beginning, but at each event, in addition to having conversation with our facilitators, we also offer resources. And so we have a cute giveaway bag that I love, and inside of those are a swaddle and sleep sack. We also have an infant feeding support or nursing pillow. We also have informational handouts, a safe sleep resource guide. And in addition is also we can offer bassinets. So if a family expresses that they don't currently have a safe sleep place for their baby to sleep, we mail them a bassinet. What I also love about the mailing piece is it removes the burden from folks to get it home. They could be using public transportation. They, cannot be able to get this bassinet home. And so if someone expresses that they don't currently have a space for their infant to sleep, we're able to mail them a bassinet right to their home or the address that they say. And that's not currently seen, but I just wanted to share the resources that we're grateful to be able to share with families. And so we see an increase in some of the use of these products. We see an increase in the swaddle and sleep sack use. We also see an increase in the infant feeding or breastfeeding support pillow. We see that folks were using the informational handouts and safe sleep resource guide at the 1 week mark, which we love. It's unlikely that they'll go back again at the 1 month mark. Some folks did. But what I love is that the safe sleep resource guide, 70% of participants were looking at that 1 week post event. And so our resource guide doesn't just have safe sleep and breastfeeding resources, but also has other resources such as food insecurity, home insecurity. And so we have a multi-sector team that has helped guide this project from the very beginning. And it's comprised of our panelists that you'll hear from today and other doulas, other physicians, other trusted community members and leaders in the community that have really helped guide this project. And something that we've done along the way is comprise resources. Early in our conversation, folks share there may be a resource online, but when you call the number, it doesn't work. And so it's important to hear from the community what resources are actually there. And so we've comprised all those resources and put it on a safe sleep resource guide. There's both a printed version that we share, and there's also an online version. And that we continue to update to make sure folks get the most up-to-date resources. So even though they may come to hear about breastfeeding and safe sleep, we want to make sure our resources that we share are comprehensive. And so the fact that 70% of folks were looking at that 1 week is helpful for us. Finish with talking about sustainability. And so from the very beginning, we've talked about how can we make sure that these programs are sustainable? Like I mentioned, this is a 3-year grant, and of course we're applying for other funding in different places, but we want to make sure that we're always thinking about sustainability. And so how we've done that is making sure that who we recruit to be a part of the program is folks that are already doing the work in the community, those trusted community members. So here we have best birthing services, Ready, Set, Push, reaching our brothers everywhere. They're constantly doing the work, having baby showers, having events, having breastfeeding classes, and having perinatal classes. And so by giving them the information about breastfeeding and safe sleep, they can use that information in all the other work that they're doing. So we're very intentional about making sure that we partner with folks that are already in the community, that are already doing amazing work, and that we can just join them and continue to do this work. And so you see this picture here. Allison mentioned in the very beginning that we partner with Healthy Mothers, Healthy Babies. So you see the sign in the back. We also see some of our board members, Kiana, who's here today. And also we have our Boppy breastfeeding pillow, and Boppy's attorney is here, and he lives in Atlanta, graciously has helped us get resources to events. And then there's me. But so we want to make sure that we're creating those sustainable partnerships, partnering with folks that are already doing the work to continue to do this. So building partnerships, so even after this grant funding ends, we can continue in some capacity to do this. I think that's it for me. Thank you guys so much for listening to our event data. We're so appreciative that you're here and to hear about all the things that we're doing. I do want to share that we are getting ready to implement this program again in year 3 of our grant. And so that'll start in January with the community partners you see here today. We're also adding a community partner and expanding to do this work in NICU settings. And I think it's so important to do this work, especially amongst vulnerable populations. So we're excited to continue to expand. And I'm so grateful that all of our panelists are here today. They've been a part of this project since year 1, with an email that just asked if they would come along with us for this journey. So very excited that they're here to share their perspectives today. And Allison,
So
I'll pass it back to you.
thank you. And you could just leave the slides up if you want. We do have some questions in the chat. So before we get to our panelists, I'm going to ask you, someone asked if you could share a little bit about how we train our facilitators and what that looks like, what sort of training they receive.
Yeah, so I can answer that. I know Barb's also here, but I can start. So that's a great question. And so folks do a 2-day training with us. And the first day is we go through each of those AAP recommendations and talk about the reasoning why behind them, why it's important. And so that's the first part of the training. The first part of the training also includes a portion about implicit bias and realizing that we all have biases. And so Barb talks about that and how important it is to recognize that. And then the second part, which is my favorite part, is the day where we do role playing and engagement. And so I think that's the part that really prepares folks to have these conversations in the community. And so we have a couple scenarios and our facilitators jump in and role play those. Because like I said, you're going to meet different families that are at different points in their parenting journeys. Maybe you meet a family that's experiencing homelessness or housing insecurity. And so they're saying, how can I implement safe sleep in my environment? You may have a family that says, I really want to bed share and I don't want to change my mind, right? How can we have those conversations and mitigate risk? And so we have those role-playing scenarios, and someone's the family and someone's the facilitator, and we have those conversations. And I think that's the piece that really equips folks to go out. We also talk about the resources that we have. I know I shared a little bit about that. So it's kind of what that second day looks like, just preparing folks to be out in the community. And the first day is more of the educational piece to just make sure that our facilitators have that institutional knowledge that they need. I hope that answered it.
Yes. And another question, how do you recruit the facilitators?
Great question. And so being in partnership with Healthy Mothers, Healthy Babies, they already had a list of community partners that were doing the work in the community. So we'll hear today from Ready, Set, Push, Best Birthing Services, Reaching Our Brothers Everywhere, that are already engaged in perinatal education. And so they reached out and recruited their 2 grandparents, 2 doulas or lactation consultants, and 2 dads. And so that could be their family member. That could be someone they work with. We just wanted to make sure that they were trusted community members. So we really leaned on them because they know their community best, to choose who the facilitators would be. And then they shared that with us. And then that's when we engaged in the training.
And then I honestly don't even remember this. So I'm going to ask you, the 32% that said they would still bed share, did they give a reason why, or was there any understanding of why they chose to do that still?
Yeah, so there wasn't much as to why they decided to do that. Our facilitators may have more of an insight on that because they were the ones that were actually engaging in those conversations. But in the survey, there's just a selection of where's your baby currently sleeping? And after these discussions, where do you plan to have your baby to sleep? So we have that comparison, but that's a great question and something that we can look into as we're planning our evaluation for next year. Some questions as to, well, what are some of those barriers? And, do you need any additional information? So thank you for asking that.
So I'm going to turn it over to the panel discussion now because I want to make sure we have time to reach them all. And very quickly, we have Terry Miller with the Georgia Department of Public Health, Kiana Ayers, who has the owner of Ready, Set, Push, TL, Best Birthing Services, and Carl and Israel Root, who are with Reaching Our Brothers Everywhere. And I'm so proud to say Israel is a new dad. So he has that lens now as well. So I want to start with you, Terry. Can you just briefly speak, because there are people from literally all over the world on this call, about the current state of SUID in Georgia and what your efforts are to improve it?
Sure, be happy to. And just real quick, fantastic results. I was really excited to be able to hear such a great report out on your efforts. But in Georgia, as of 2022, we had 209 sleep-related deaths in our state. And so that averages out to a little, about 4 infants that are dying each week due to sleep-related causes. And so when we mention sleep-related causes, we are talking about SUID, or sudden unexpected infant death. And to get our SUID numbers, we actually pull 3 of the death certificate codes. So that's SIDS, suffocation, strangulation in bed, and unknown. And those numbers did go up for the past couple of years. So we've had a steady increase in all infant mortality, but also SUID. And so for prevention, we are just doing our best to encourage and build up that local capacity, like the work that you all are doing, to help so that when the messages come, they come from people within the community, from trusted members of the community. So we're really doing a lot on building local capacity for education. We've done some expansion into some of our more higher risk families, if you will. Like we have a shelter-based program. So we're trying to reach our unhoused and underhoused families. We're launching a first responder program so that, again, we can get some information out into trusted members of the community. We work on our data just to try to make sure that the awareness is there and people understand where our highest risk can be. We do have disparities, including things like our Medicaid families, our Medicaid enrolled families have a 4 times higher risk of death than other insurance payers. We know preterm infants are a higher risk, those kind of things. And so awareness, and we support all the policy measures that are out there. My office, we can't do a whole bunch with that, but we can add that data and advocacy towards thoughtful policy that would help to support families.
Thank you so much, Terry. And really, thank you for all the support you've given us. You sit on our multi-sector task group, and it's so nice to have that multi-sector task group that brings everybody together from so many different perspectives. I'm going to turn it over to our facilitators because truly we couldn't do the work without them. And, one of the things that is very important to First Candle, and we've heard this when we were doing our focus groups, is so many communities get frustrated when organizations come in, pick their brain, ask for their information, and then leave. And we assured everybody when we came into the community, we're here to say we're not leaving. We are continuing that support. And that is something that's very important to us because we heard that loud and clear. And I think when we started these Let's Talk community chats, our first goal was to listen and hear what everybody in the community was saying so that, and allow them to guide the process, because we know that the community has the answers and it's up to us to listen and to support rather than take over. So having said that, I'd like to turn to all 3 of our facilitators, and I'll call on each of you, of why you decided to become a facilitator. And Kiana, I see you, so I'm going to start with you.
I think it was an easy yes, but partly because I have already had a relationship with Healthy Mothers, Healthy Babies, and plus most small organizations can attest that like marketing is like low on we don't have marketing budgets. So for us to be able to participate in a project like this, but also be able to provide access to the programming that we already have for our families, it was obvious that it was going to be a good fit for our community.
Terrific. T, what about you?
Some of the similar things. I already had a relationship with Healthy Mothers, Healthy Babies, and I'm a Connecticut girl, so that was a bonus. But being a person of color, a melanated person, I realized that we don't have as much education and information as we need to be able to be successful as successful as we can be as parents. So when this opportunity arose, it was yes, an easy yes for me as well, because I love all things women and all things birth work, and to be able to help someone to prevent something that most of us would never even understand was something that really took to my heart. So it was easy for me to be able to be a part of this initiative.
And Carl, I see you down there.
Yes, hello everyone. Reaching our brothers everywhere. Our mission is to educate, equip, and empower men to impact an increase in breastfeeding rates and a decrease in infant mortality rates in the African American community. And we, like our name indicates, we are reaching out to brothers everywhere to get them involved. When my involvement and my engagement was driven by the data, when I saw that our women and babies were dying at higher rates than other communities, I said, oh my God, not on my watch. That was my attitude. So that's why I'm here.
And Izzy?
I think for me, it was about the education. Always been about, educating others and helping them, informing them so that they can make their own decisions. That was what I grew up around. Um, the more you know, the more you can involve yourself in, but also uh, you can help others, and others can help themselves with the information. So it was pretty much adding tools to my toolbox, but also adding another layer of resources to help the parents that we serve, the families that we serve, so that we can help them even more.
And I'm not sure if Destiny mentioned it, but we compensate all of our facilitators. We compensate our host organizations. And getting dads involved was so critical to us because we knew that dads wanted to hear from other dads. They didn't want to hear from women. And so that was such a key to this. Can you, I'm really curious to ask, and I'll turn this back to Kiana and start with her again. Can you tell us about some of these conversations with parents? And do you think this is making a difference? And I'd particularly like to ask you to share the story about the one woman mom you brought to one of the Let's Talks.
Yeah, so because I'm a registered nurse and a lactation consultant. We had, I think her baby was about 5 or 7 days old, and she came to one of the events. We were able to help her with lactation right there on the spot. We were able to provide her with donor human milk. And eventually, as the story goes, we were able to have her be exclusively breastfeeding her own baby. So for us, knowing that people knowing that we're there. So we had our very last event was like, I almost felt like I was being punked. I was like, are there cameras here? It was like 8 women. They were all pregnant. One of your interns came to that event and they all just sat around. We talked about pregnancy, doctors, pediatricians, safe sleep, breastfeeding classes, childbirth classes. It was like perfect. They were strangers, but we all just kind of melted into each other. We had this nice banter back and forth. Well, what do you think about this? And what do you think about that? And we just got to really educate in a very informal setting. And I said to myself, this is what these events are about. This is how, and you know, I hear you, I hear you, Dr. Daigle, you're like community. Yeah, it was magical. And so I I I know that as the work that we do in my community, like I said, having you guys on the other end advertising the events and letting people know that hey, you can come here and learn information about safe sleep is just something that as smaller organizations we just aren't able to do. So when we're able to have that reimbursement, which is important, but also having the connection to the community, like you guys have already mentioned, it will last way longer, even if we aren't funded anymore, because now we're even more established in the communities that we're already trying to serve. So she is happily breastfeeding. She does not need donor milk anymore. And if we weren't there that day, we wouldn't have interacted with her. So yeah.
Right. And that's what I love, because unlike health fairs, we're really taking the time to talk to everybody. Like you said, it's kind of like a big party where you're talking about safe sleep and breastfeeding and everything else. T, what are your thoughts?
I love that we are able to have the one-on-one conversation, and we've got at our events, we've got moms, we've got dads, we've got grandparents, we've got people who are new to parenting. We have old school people who are like, no, no, that's not how we did it, that we're able to re-educate and let them know why it's important to create a safe sleep environment for your child, how we are also very blessed that we are still amongst the land of the living because of the things that we grew up with, like being put on a couch at the family reunion, or sleeping with our cousins and everybody's all over each other, or not understanding what it meant when your breast started to leak, that it's a sign that your baby's ready to feed, or, you know, that you can have the power for young mothers, letting them know that their voice is powerful and that you can tell the person who's watching your baby, no, this is how we're going to do it, and educate them as to why. Because there's a difference between telling someone, as we grew up, do as I say, not as I do. There's a very big difference between telling someone why they should do something and how they should do something versus no, just do it. I was also surprised at how many people said that they did not get any of this type of information while they were at the hospital. So I'm super excited that, you know, this reach is going into the hospitals, because it is something that we should be telling people when they're still pregnant, when they're at the hospital, when they're at their doctor's appointments, to get them ready so they know what to do once they are at home. And if we're already educating them before they actually bring their bundles home, then they feel more empowered and more equipped to say no to things that are not happening, that are proper, to say this is what we need to do, to be comfortable in knowing, you know what, you can bond with your baby without actually co-sharing with your baby, co-sleeping with your baby. There are other things that you could do. And this also relieve stress on mom, because you know there are a lot of moms that come in that they feel very lonely, they feel helpless, they feel like I've always got a baby attached, what am I going to do? And you give them the little tools that they need to build on the foundation, and they do trust you because they know, you know what, she's going to be here, they're going to be here next month if I need them, or they've given me their number, they've given me a resource. So it's not like they're coming in and they see Kiana or Carl or Izzy or myself, and they say, I'll never see these people again. They now have an ability to reach us in other capacities as well, when they need the assistance, so that they know that they are not alone. And part of the thing that we are building is a strong community, so that people know you're not doing this alone. And there's somebody in this room who's going through what you're going through, or who can help you and walk you through and hold your hand when you need your hand held. So it's been a great experience. I think the most memorable for me was an aunt who's now responsible for watching over everybody else. And she was super tired. How am I going to take care of myself and this baby and my niece? And we teach them ways to do self-care as well. In all of this, there's always an element of self-care incorporated in when we're talking to people. So, you know, I now at my events, sometimes I do sound bowl therapy. Sometimes we just have a listening session. There's music playing in the background, and just being able to come outside of the house into a different environment to people who don't expect anything or want anything from you and are just offering a hand of love and advice is just everything.
You said it so perfectly. And, you know, one person asked, how long does it take for a family to receive a bassinet? And I can answer almost immediately, because we ship that to them right away when they need it. And I think, you know, understanding how to use these products, that you can walk through it with them, is so important. Carl, to you, what do you think about these conversations with the parents? And do you feel like it's making a difference?
Most definitely, it's a lifeline. These conversations are a lifeline, because not only does it give them awareness about, information around safe sleep, even breastfeeding and other things, it also gives them access to resources. And when you have collaborative partners like Healthy Mothers, Healthy Baby, and even, Miss Thompson and Miss Ayers, their organizations that are equipping even us, because I met Miss Ayers early when I came into this space. I came from the responsible boyhood, manhood, fatherhood space. But one thing that was left out was the whole maternal and child piece. So I got introduced to it by Miss Kiana Ayers. Thank you so much. Great training. And we got a contract with a local insurance company for which she also did work. So we received the benefit of all of your experience, even you as a survivor, Allison. The benefit of the training that we received from you all positions us to be able to talk intelligently with men and their families about safe sleep. So you give us credibility. And being in Georgia, you just heard, I know we're number 3 in maternal mortality. And I just heard, I think Destiny said we're like number 10 in infant mortality, 10th highest. So with that kind of data, we're positioned and equipped to be able to let a man know, listen, our babies are dying, but there's one intervention that can really, really change these numbers for the better, to the positive, and that's your involvement. You're being more supportive. You're being more educated about how to support, and these type things really. This is what I think about the conversation. They're invaluable. They're like gold. Like Izzy said earlier, these are tools for my toolbox. And when you have tools, you use those tools. You can use those tools not only for yourself, but to help someone else, like he mentioned. So
Yeah.
I'm excited about you all having the foresight to even facilitate this type of event. So thank you for being partners, great partners, because you share the resources. Again, we're resource deprived in most of our agencies.
Yeah.
And we really, this partnership and you bringing the resources to bear, because most of those that we serve can use them.
Yeah. Well, and I'm excited to say, and Destiny didn't announce it, but word of mouth grows and it expands. And we put out a press release about a month ago. We now have a partnership with Dear Fathers, which is one of the largest social media spaces for Black dads. They have over 100,000 followers, and we're going to be working with them down in Atlanta at a Hawks game so we can bring say Let's Talk community chats to their audience as well. Izzy, as a new dad, I want to now talk to you. We heard from a lot of dads that even if you are allowed into the pediatrician's office, that they feel marginalized and sidelined and everything goes to mom. But we know because of the maternal mortality, there's a lot of single dads out there. And so I'd like to ask you, as a new dad yourself, did you feel like you received this information from your doctors before these Let's Talk chats? And how responsive are dads to this information you're now giving?
I believe for me, I didn't really get the information. I was in the doctor's office or the pediatrician. I feel like the information started with the rooms that I was in. Just being intentional about um, learning about what it takes to raise a child, the pregnancy process. I also myself, T, my dad, my mom. We also were a part of a perinatal navigator training with Morehouse School of Medicine. So being intentional about the rooms that I was in, where I could get the information that I needed, uh, not only for myself, for when I plan to have a child, but just to serve the families that I serve, I think was the biggest thing, was being intentional about getting the information and going to places that were providing it. Going to Black maternal health conferences, getting those different, having conversations with the people who serve the community, the organizations and corporations that have the resources. I think it was the intentionality behind it. So for First Candle to be intentionally seeking to educate people and then provide the resources to back that up as well is like my dad said, invaluable. You have a lot of organizations and places that just talk about it. They plan, um, they talk about how they want to help, and they're they're not really giving you what you need on the back end as far as the resources or the incentives to get people out, because we deal with these people all the time. We give of what we have until sometimes you run out, and conversation is all you have, and that in turn will build trust with us, but also is dire that the people get the resources that they need, from the boppies to the swaddles to the bassinets, because these are things that are pivotal to their baby's health. Um, Even things
Yeah.
from knowing that you need a car seat to leave the hospital. All these things should be taught way before the child is here. And I feel just the conversations have to be had, and we have to host forums and uh, venues for talking about these things.
Yeah. And so have you found at the Let's Talk community chats, the dads knew this information, or did you really educate them, and were they were they going to go home and practice it? Were they excited by it?
I think for the most part, it was pretty new. We had a lot of gentlemen that were excited about seeing us out in the community doing this. No one said that they had been a part of anything like what we were doing. So that was very gratifying to see that they enjoyed seeing us. And it became, oh, are you all doing this more? Or are you doing other things along this line? And it became some of that as well. But also we were able, I know we talked about bridging the gap and working into, in the new ways. I remember specifically at a resource fair we had um, at our office, or a T joined us, and there was a mother who needed some help with breastfeeding. We were talking about safe sleep, and she was talking about having the baby sleep in the bed with her because it was easier for her to breastfeed and more uh, accessible for her to breastfeed when she's tired and she wouldn't have to get up, get the baby. And T was able to help her with that, because then she said she was having breastfeeding trouble. So we had lactation consultants in the building already. But then T also spoke with another mother who, no, it wasn't the mother, it was actually the partner of the mother, her female partner. And she expressed how she had raised her child over 20 something years ago, and this new wave now, her and her partner having a new child, being, I believe the child was like 1 years old, 6 months old to one. And she was just talking about the nuances, what was going on with parenthood. And they had a long conversation about that, and I was able to sit there and just hear and learn just from their conversation. So the conversations are invaluable. I believe we just have to host the right events and have the right spaces so that we can grow what we're doing tremendously.
Yeah, I think
And
that our events create a safe space for people
Yeah.
where they
Yeah.
feel like, this person looks like me, they sound like me, I can trust what they're saying, and we're not judgmental. Okay, if you said you were sleeping with your baby, let me explain to you why you shouldn't. And let me give you some tools on how you can get past this. And let me show you how, if you nurse your baby and you're laying down, what to do as soon as the baby has been fed and burped and you put your baby away. So I think it
Absolutely.
is really big that we create a safe space for them.
And I think more opportunity to come back. So like for us, we're going to be starting what we call Milky Mondays in January. Well, when we do these events, and then now we can say, hey, come see us again on Monday. If you need support for breastfeeding, we're here during these hours. Or if you need a class, it just helps to augment what we have going on so that we can increase that sense of community, because it's different than when you're going to something bigger, right? You see people like, what it said, you may not see the same people again. when you go back, or you say that lady I met or whatever. But with us, you're going to see us again when you come back. So
Exactly.
it's a really powerful way for a larger organization to support the smaller community organizations. And I think if anybody's thinking about replication, that really is the key, is that you need to find the people. You can't just plant people in communities who don't know the community. You need to really, find
Amen.
the people that are already there doing the work, so that, and we have love for our spaces and our community. Like we want to do this work. We have a passion for what we do where we are. So
Since I have the three of you up there, I'm going to ask one last question very quickly. And I think all of you know me well enough that I call things out. And I know when this first started, there was some question about what's this white lady, Barb, going to be doing, coming in and talking to us about safe sleep. And I would love for you to talk about the experience of having Barb train you.
We love Barb.
Love Barb. We love Barb. Barb is a small package filled with a bunch of stuff. And, honestly, we can laugh and say, what's this little tiny petite woman going to say to us? And we look different. But when we talk to Barb, we're the same. We're the same. We're mothers. We're lover of women. We want to educate the community. We want to empower and strengthen. And it's not like that. It doesn't feel like I'm a melanated person and this is a European woman. This is my sister.
Yeah.
Who has come to
Amen.
help me educate the community. And we're going to do this together. And it's quite impressive that she does not back down. You want it, she's gonna give it to you. You need it, she's gonna give it to you. So we love Barb. We love
that's the
Thank
thing
you.
too, the hearing us, right? Because she seems to genuinely want to hear what we have to say. So oftentimes when programs have been decided, they've already been decided. They've already been incorporated. This is how you're going to do it. Here's the layout, take this. But this has felt a lot more collaborative, and we have a lot more autonomy because we're not just, we know that safe sleep is one portion of the issues that our community has. So it's important for all of us to be able to have space to talk about all of the issues that our community has. And we have that space with the wide variety of people that we have as facilitators. And so that makes this a lot more unique because we're not beholden to just that one topic. It's incorporated. We need to do it, but we also know that when we need to talk about, if somebody needs to talk about child support, or somebody needs to talk about housing, or somebody needs to talk, we have the space to do that. So that makes it really good. And Barbara, oh, she has the warmest eyes. Like, I don't even know if that makes sense, but she has like when she's listening to you talk, you can tell she really wants to know, like, what is it that you guys are doing, and what can we do to make it better? We appreciate her.
Well, thank you so much for all you do. This is absolutely perfect. We have 2 minutes left. I'm a big stickler for keeping people on time. I do want to just make an announcement that we will be hosting our conference in San Diego, October 2025. It is the Perinatal and Infant Safe Sleep Conference. We would love everybody to attend and to submit abstracts. But it's going to be a great conference. It's researchers, parents, community advocates really talking about health equity too. So last comments, Destiny, would love to hear from you to wrap it up.
Yeah, just thank you. That's all I have. That's all I have. I'm really excited that the facilitators, our community partners were able to join. So I just want to say to you guys, thank you so much for being a part of this, for joining us along the ride, for answering all my emails and calls and all the planning. I'm truly grateful for all of you guys. So just thank you. And thank you everyone else for being here and for listening to the work we're doing. We're really excited to start this up again next year. And I'm sure we'll be continuing to share the findings and continuing to do this in other communities. So just thank you.
Thanks, everybody. Have a great holiday season. Bye, everybody.
Bye. Thank